Alright, so we're talking about the vodoo band. So they're in the mobility buckets that we have around the box, and ask your coach for one. So Melburns would have elbow pain. You just say when he does a lot of pulls or heavy weightlifting movements. So if he notices the pain in his elbow, so what we're going to do is we're going to wrap this and basically cut the circulation off momentarily, and then we're going to get it moving so that we can bring blood to the area. So we're going to start below the heart and work our way up. So I'm just going to wrap it up and put it down. It's better to do it with a buddy because they can control. Alright, so I'm going to do it at about 75 to 80% of the tension that you can create. So I'm just going to kind of work this around. You go right over the joint. So I'm working my way up, I'll go right over the elbow. Keep pulling, keep it nice and tight. So again, I'm working away from the heart toward it, and then I'm going to leave a little bit of slack, so that way I can come back. Kind of wrap around the top. So right now it's pretty tight, as you can see. This area is going to start to change color as opposed to this area. So what he's going to do is you can use this on any body part. If your knees are bothering you, your ankles. Right now we're just going to work on the elbow and apply it to everything else. So what he's going to do is he's going to start to move his arm so he can bend it. He can move his arms around. So we want movement. So what that's going to do is going to bring blood to the area. So he's just doing some arm flex and extends. So what he's going to do now is he's going to come down into his push-up. Not that it seems to bother him, but it's going to be good movement for the joint. So he's going to send those elbows back. He's going to come down into his push-up, and then he's going to come back up. So he's going to do a few of these. All right, good. You can stand up. So you can also roll on it, and you can also do any types of movements. So you can put it on your knee, you can do squats. So maybe keep that on for just a few minutes. When you start to feel like your fingers are going numb, or you start to feel your hand tingling or starting to turn white, then you just take it off. So what's going to happen is when you take it off after a few minutes, there's going to be some marks on your hand, but basically it cuts off the circulation, pump blood, it's trying to get to the area, and then when you release it, the blood flows back to the area and helps facilitate the healing. So move it around, roll it, stretch it. You can use the vodoo band to basically help any part of the joint, any part of the body that's going to need some help.